So let's move to the next question. So this question is related to the chemical injuries, where a laborer is coming who is working at a construction site with the red eyes and history of tuna particles falling 1 hour back. So tuna particle injury is actually a chemical injury or a chemical burns. Whenever we have chemical burns in the eye, basically these are also the emergency conditions which can present with the acute red eye. Can you tell me the DD of acute red eye as well as the type of vision loss that can present in the patient? So whenever you have this acute red eye, we have a DD, right? The most common DD, though we are discussing it in the chemical burns, but yet chemical burns is not the most common DD of this acute red eye. Either it is acute congestive glaucoma or acute anterior uveitis. ठीक है. Now the type of vision loss that you are getting here will be the sudden as well as painful. This will be sudden as well as painful diminution of vision. So this patient of chemical injury can also present. Why indirectly I am saying? Because due to the chemical burn also, it will lead to acute anterior uveitis. We will have lot of inflammation. Due to inflammation, we have acute anterior uveitis, and therefore indirectly again it is the acute anterior uveitis which is presenting with the acute red eye. Okay. So it can be now the acid injuries also, or it can be alkalis. Hi Krishna, I could not get what are you trying to say. Alkalis injury, and it is the alkali injury which is actually more severe, because we always have more risk of perforation. Here we have the risk of the perforation, and that is why it is the alkali injury which are more severe in comparison to the acid injury, though the treatment pattern will remain same whether it's a acid injury or whether it's alkali injury. So if you go with the treatment, because it is an emergency condition, we have to first bring back the pH. Okay, so for this we have to do the irrigation. It's very important that you have to do the irrigation of the conjunctival sac thoroughly for about 40 minutes to 60 minutes or 1 hour. Now this irrigation of the conjunctival sac can be done by the basal salt solution, which is considered to be the best. Otherwise, if this is not available, then also you can do with the normal saline or by the ringal lactate. Now of the records, if I am telling you that when it's an emergency and you have to irrigate the conjunctival sac, even if you do not have the basal salt solution, you do not have the normal saline, you do not have the ringer lactate, no problem. You can wash with the distilled water, RO water, tap water, anything, so that we are able to remove the acid particles, alkali particles, tuna particles. We have to flush the particles, we have to bring the pH back. Okay, even if you are in emergency, because inside people aims, people are very fond of asking the practical things. So if the patient has come to you and you are alone, then also you can take 2 bottles at one time in both of your hands and prick it. I clear my Emily exam 3 stage. I got license. Your lecture helpful, ma'am. Oh, thank you so much. Heartiest congratulations. You could clear Emily examination by these notes. I am humbled and I'm very proud of you. Very happy for you. So you can use 2 bottles there. You can prick with a wide bore and you can start irrigating even alone in the casualty till the time. So 15 minutes is not sufficient. Basically 30 minutes, 40 minutes, or even 60 minutes that we have to do. Once you have done, now what will be the step number 2? Step number 2 may we have to do the double eversion of the eyelid. We have to do the upper eyelid, so 2 times we have to evert it. Now you would say that we are not ophthalmologists, we cannot evert it. So you can take the support, you can take out the refill from the pen, you can put it here, you can take the stirrers, the tea stirrers, you can take the kajal pencil or the mascara pencils also you can put here, and taking the support you can evert it back. And once you have everted, you have to remove the deeply embedded particles. So that is very, very important because these particles are deeply embedded and they are going into the fornix area. So it has to be removed at the earliest. Once you have done this, you have done the irrigation, the particles have gone into the eye. So obviously some amount of necrosis they have done. है ना? So what you have to do is the removal of the dead tissue. That is the debridement. Next May we have to do the removal of the dead tissue. It is the removal of the dead tissue we have to do. Now once we have done the removal of the dead tissue, then we have to use the topical drugs. Topical drugs may, now why we are using the drugs after the debridement, because obviously when you are putting the drugs it will not be able to act over the dead tissue. So first you have to do the debridement and only then we have to give the drugs. Now which drugs we have to give? What are the drugs that I can give? I have to give the steroids. Now you will say that there are chances of perforation, then why we want to give the steroids? For the congestion. There is lot of congestion, guys, so I will have to give the steroids. I will have to give the tetracycline. We can give the tetracycline or the tetracycline group of drugs which is preventing the perforation. To prevent the perforation, we have to give this drug. You can give toxycycline, can give tetracycline, and then we also give the citrate. Citrates will be acting as the antidotes. No, all these drugs have to be given. So obviously we have to give the antibiotics because there is a risk of infection. But here the tetracyclines or the doxycyclines that we are giving, they are not just given to prevent the risk of this for the infection, but also to prevent the risk of perforation. If you see in the corneal ulcers also, whenever we have bacterial ulcers, we have impending perforations, then we give the tetracycline group of drugs. So tetracyclines or doxycyclines, anything can be given. Steroids, obviously under the antibiotic cover for a limited time. In order to combat the congestion, you have to give the steroids. So while I'm writing steroids, I am telling you disclaimer continuously that it has to be under the guided vigilance. And of course the citrates, which is anti-neutrophilic, anti-proteolytic, anti-collagenollytic, so a definite antidote. Hina, yeah, thank you so much, guys. Tomorrow is Karva Chauth, and that's why Hina is there. So this is whole of the topic on the chemical injuries. Acid injuries hai or the alkali injuries hai. So you can do this question now. I hope, can you see how will you manage this condition? We can easily give the irrigation with the normal saline, and we can give, now if you see, topical antibiotics have to be given. Cycloplegics for pain relief can be given. Patching the eye we will never do in the cases of chemical injury. uh, Tarso ref भी नहीं करेंगे. Whenever we have the risk of infection, we will never close the eye, we will never cover the eye, we will never patch the eye. But yes, here first and second is okay. Irrigation with normal saline hai, but obviously priority. Now I once we have discussed this. I will tell you one more thing. See, PYQs are important, but it's very important to tell you the practical problems that you face doing the question. So here first and second both seems to be right. So what happens when we have more tricky questions? It is actually the more close options. Questions are same more or less, but the answers, the options are getting more and more close. And that is the reason they are becoming more tricky. So even if you get a such type of a question and you have options like this, please see which one is more preferable option, the better option. Okay, so better option in terms of order, if you see, the immediate thing that you have to do is the irrigation of the normal saline, and that is why answer is A. Okay, in the paper also you might get the question where more than one option seems to be correct. Please see the order. What should be done first has to be given as the answer.